I'm Dr. Zhao Jing. I'm a consultant neurologist from Mount Elizabeth Orchard Hospital located in Singapore. And my specialty, as I mentioned before, is neurology, which specializes in seeing patients with conditions such as dementia, Parkinson's disease, headache, strokes, and so on. From a neurologist's point of view, it's actually basically a loss of cognition. And that cognition function actually doesn't comprise of just memory. It actually has other areas of the brain function, such as visual spatial, language, which is also a cognitive function, as well as executive function, which from a person's understanding is actually the ability to plan and make good sound judgment. Some of the earlier symptoms that a patient or caregiver can notice will be if they start to have memory loss, which is actually one of the key features in the most common form of dementia, which is Alzheimer's disease. So memory loss can include things like in everyday life, forgetting whether they had taken medications, forgetting where they put their things and items, forgetting the dates and time, as well as situations where they don't remember people's names. So that's actually quite common as well. Our clinical practice, dementia diagnosis is actually multi-modalities. So firstly, we take a history where we find out from the caregiver as well as the patient themselves what are some of the symptoms that they have experienced over the period of time. We also want to assess what is their risk factors to get dementia. On top of that, we do a physical examination as with all doctors consult. And finally, we do have to administer cognitive testing, which is like a bit of an exam to test how you fare in the various aspects of cognition. And in the latest updated model, we actually also include testing of some of the markers in our body to assess whether a patient has dementia. Treatment options can include pharmacological, which includes medication, as well as non-pharmacological, which will include a lot of lifestyle modifications. So for pharmacological treatments, some of the older treatments include cholinesterase inhibitors, which are basically medicines that help to slow down the progression of dementia. However, in recent years, there have been a lot of new, what we call anti-amyloid monoclonal antibodies, which are basically, it sounds like a mouthful, but it's basically medications that are even better and more targeted at slowing down the progression of dementia. Lifestyle modification is actually a very key and important role in slowing down the progression of dementia. And in fact, if started in very early on in life, exercise, I would say that's actually very important. And I always encourage my patients to lead a very healthy, active lifestyle in terms of exercising from a very young age. Diet is actually very important. So some of the healthier diets include the Mediterranean diet that is actually very good, comprising of whole food, healthy fats, vegetables that help for patients to lead a healthier lifestyle. I would also greatly encourage communication with people, because these are actually things that are very good, very important to keep the mind active. And that also includes learning new things as well, and to avoid neurotoxins. We call it toxins that are harmful to the brain. So that will include a very common thing that's consumed, which is alcohol, because that's actually quite harmful to the brain. Mount Elizabeth Hospital is actually one of the hospitals in Singapore, I would say, have quite cutting-edge advancement in terms of technology as well as medicines, in the sense that we want to use the best for our patients. And so, example for the treatment for dementia, which patients from all over the country as well as all over Southeast Asia actually do come to Mount Elizabeth to seek treatment with, especially sometimes we use very advanced treatment, targeted treatment for dementia. I always ask the children, the caregiver, to imagine themselves taking care of their kids. So the process of taking care of a patient with dementia is very similar to the process where the children's parents used to take care of them when they were growing up. So from simple things like eating, feeding, learning how to use different kind of pen, pencil, utensils, the encounters that caregiver may face along the way when they have to take care of patients with dementia. So for the same love that the parents had given them when they were young, they would be giving back to their parents in a similar manner where they have the opportunity to take care of their parents when they grow old. So it can be challenging, and I would still encourage the caregiver while they are taking care of their parents to also take breaks, reach out for helps. There are communities out there where people are experiencing the same thing, and they can also have a community to help each other in that aspect.